Most people believe that if a doctor recommends surgery, it must be necessary. That assumption has cost people years of their life. Not because doctors are careless, not because medicine is broken, but because there is a gap between what is possible and what is actually needed. And inside that gap, thousands of unnecessary procedures happen every single day. I want you to think about something for a second. If your body could heal without being cut open, would you still agree to surgery? Or would you at least pause and ask one more question? My name is Dr. Bianca. I've spent nearly 2 decades working alongside surgical teams, reviewing patient outcomes, and watching what happens not just during the operation, but months and years after. And what I've learned is this: there are procedures that save lives, and there are procedures that change lives in ways people never expected. Today, I'm going to walk you through 5 surgeries that I would personally delay, question, or in many cases refuse, unless very strict conditions are met. Not because they're always wrong, but because they are very often done too early. And once they're done, there is no going back. Let's start with one of the most commonly recommended procedures in modern medicine. Now let's talk about knee arthroscopy. On paper, it sounds simple. A few small incisions, a camera inserted into the joint, a quick cleanup of damaged cartilage or tissue. Patients are told it's minimally invasive, fast recovery, low risk. But what most people are not told is what actually happens inside that joint. Your knee is not just a hinge. It's a finely balanced system of cartilage, ligaments, fluid, and pressure distribution. The moment instruments enter that space, even through tiny incisions, the internal environment changes. Fluid is pumped into the joint to expand it. Tools scrape, trim, sometimes remove small portions of cartilage. And while the intention is to clean up damage, what often happens is something more subtle. The joint loses part of its natural cushioning. Now here's where it becomes important. In patients over 40, the cartilage does not regenerate the way it used to. So when even a small amount is removed, the joint begins a slow progression toward increased friction. That friction leads to inflammation. Inflammation leads to more pain. And months later, the patient who expected relief is back in the clinic, often being told they now need something more serious, like a partial or total knee replacement. There was a large body of clinical data over the last decade showing something surprising. In many cases of mild to moderate knee pain, especially due to age-related wear, arthroscopy provided no better long-term outcome than structured physical therapy. No surgery, just targeted movement, muscle strengthening, and joint support. But surgery is faster, it feels more decisive, and for many patients it feels like action. The real question is not, can it be done? The real question is, does it need to be done now? Because once tissue is removed, it doesn't grow back. And the knee remembers. Now let's move to something even more common: gallbladder removal, also known as cholecystectomy. If you've ever had gallstones, you already know the story. Sharp pain under the ribs, nausea, sometimes intense attacks after meals. You go to the doctor, imaging confirms stones, and very quickly the recommendation is made. Let's take the gallbladder out. And yes, in severe cases, that is absolutely the right call. But here's what most people are never told before agreeing. The gallbladder is not a useless organ. It plays a very specific role in digestion. It stores and concentrates bile, releasing it in controlled amounts when you eat fatty foods. When it's removed, bile doesn't stop. It drips continuously into your digestive system, unregulated. For some people, that change is manageable. For others, it creates long-term digestive issues, bloating, diarrhea, difficulty processing fats, and something even more subtle: nutrient absorption changes. Fat-soluble vitamins like A, D, E, and K may not be absorbed as efficiently, which means over time, even with a normal diet, deficiencies can develop quietly. In the next video, we will go over 3 more surgeries. See you there. Thank you for watching and stay healthy. The real issue is not that the surgery exists. The issue is that it is often presented as the first step instead of the last. In many cases, dietary changes, bile support strategies, and careful monitoring can reduce symptoms significantly, sometimes enough to avoid surgery altogether. But that requires time, a lot of it. And time is something modern medicine doesn't always prioritize. So the faster option becomes the default. Remove the organ, solve the immediate problem. Deal with the long-term consequences later. Now I want you to stay with me for this next one, because it affects millions of people and almost no one questions it. Spinal fusion, a common surgical procedure. If you've ever had chronic back pain, you've probably heard of it. Two or more vertebrae are permanently joined together to eliminate movement in a painful segment of the spine. It sounds logical, doesn't it? If movement causes pain, remove the movement. But here's what happens next. The spine is designed to distribute load across multiple segments. When one segment is fused, that load doesn't disappear, it shifts to the segments above and below. Those segments now work harder, they experience more stress, and over time, they begin to break down faster. This is called adjacent segment degeneration, and it's one of the most common long-term outcomes of spinal fusion. Patients often feel relief initially, less movement, less pain, but a few years later, a new pain appears. Different location, same problem. And now the cycle begins again. More imaging, more recommendations, sometimes another surgery. What makes this even more complex is that chronic back pain is rarely caused by a single structural issue. It's usually a combination of factors: muscle imbalance, posture, weak core stability, poor movement patterns repeated over years. Fusion addresses one piece of that puzzle, but it doesn't fix the system. In many cases, intensive physical therapy, movement retraining, and muscle strengthening produce comparable or better outcomes without permanently altering the spine. But again, those solutions take effort. They take consistency over months, and they don't feel as immediate as surgery, which is why many people skip them and only realize later what was lost. Now let me tell you something that might make you uncomfortable. The human body is incredibly adaptive. It can compensate, rebuild, and recover in ways most people underestimate, but only if you give it the chance. And that's the part that often gets skipped. The pause, the second opinion, the attempt to solve the problem without cutting into the system. Because once you cross that line, you are no longer working with the body. You are working around what has been changed, and that difference matters more than most people realize. In the next part, I'm going to walk you through two more procedures that are often presented as routine, but carry consequences most patients never fully understand until it's too late. And I'll show you exactly what questions you need to ask before you agree to anything that cannot be undone. Now, before we go any further, I want you to remember one thing. Every procedure we're talking about today has a place. There are situations where they are necessary, even life-saving, but the danger is not in the procedure itself. The danger is in how quickly it becomes the default, without exploring what happens if you wait, or what happens if you try something else first. Let's continue. The fourth procedure is something that has become incredibly common over the last decade: hysterectomy, the surgical removal of the uterus. For some women, this is presented as a straightforward solution. Heavy bleeding, fibroids, chronic pelvic pain, remove the uterus and the problem is gone. And yes, in certain cases, especially where there is cancer or severe disease, it is absolutely necessary. But in many situations, it is offered far earlier than it should be. Because what is rarely discussed in detail is what changes after the uterus is removed. This is not just about fertility. This is about structural balance inside the body. The uterus is not an isolated organ. It is part of a complex support system within the pelvis. It interacts with surrounding muscles, ligaments, and even the position of the bladder and intestines. When it is removed, that balance shifts. Some women begin to notice changes they were never warned about. A feeling of pressure in the lower abdomen, changes in bladder control, altered posture, and in some cases, pelvic organ prolapse over time. But there's something even deeper: hormonal signaling. Even when the ovaries are left intact, removing the uterus can affect blood flow and communication within the reproductive system. Some women experience earlier hormonal changes than expected: fatigue, mood shifts, changes in energy levels. And what makes this difficult is that these effects don't always happen immediately. They develop gradually, months, sometimes years later. And by then, the connection is often missed. The original problem is gone. But a new set of challenges has quietly taken its place. Here's the key point. Many conditions that lead to hysterectomy recommendations can be managed conservatively first. Hormonal balancing, targeted therapies, lifestyle adjustments, even minimally invasive alternatives that preserve the structure of the body. But those options require patience, and they require a doctor willing to explore them with you. If surgery is presented as the first step instead of the final one, that is your signal to pause. Now let's talk about the fifth procedure, because this one affects both men and women, and it's often underestimated. Sinus surgery. Let's continue. On the surface, it seems minor. Chronic congestion, sinus pressure, difficulty breathing. So the solution becomes surgical. Chronic congestion, sinus pressure, difficulty breathing. So the solution becomes surgical. Clear the passages, open the airways, fix the problem. But the sinuses are not just empty cavities that need to be cleaned out. They are lined with delicate mucosal tissue. This tissue has a very specific job. It humidifies air, it filters particles. It acts as a barrier between your environment and your respiratory system. During sinus surgery, parts of this tissue are often removed or altered. Openings are widened, structures are changed. And while this can provide temporary relief, it also changes how the system functions long term. Some patients experience something called empty nose syndrome. It sounds mild, it is not. Air passes through the nasal passages, but it doesn't feel right. Breathing feels unnatural. Dryness becomes constant. The sensation of airflow is disrupted. And in severe cases, it creates anxiety because the brain interprets the breathing as insufficient. Even when oxygen levels are normal. This is not common, but it is real. And even in less severe cases, patients report ongoing dryness, irritation, or recurring infections because the natural defense system has been altered. Now here's the part most people don't consider. Chronic sinus issues are often not just structural, they are influenced by inflammation, allergies, air quality, diet, immune response. Addressing those factors can significantly reduce symptoms without surgery. But again, that approach takes time. And it requires looking at the body as a system, not just a set of parts to be adjusted. I want to take a moment here and say something clearly. Surgery is one of the greatest achievements of modern medicine. There is no question about that. Lives are saved every day because of it. But not every problem requires a surgical solution, and not every recommendation should be accepted without question. Because once a structure is altered, removed, or permanently changed, you are no longer working with the original system. You are adapting to a new one. And adaptation always comes with trade-offs. So what do you do with this information? You don't panic. You don't reject medical advice blindly, but you do something very important. You slow the process down. If a surgery is not an emergency, you have time. Time to ask better questions. Time to understand the full picture. Time to explore alternatives. Time to ask better questions. Time to understand the full picture. Time to explore alternatives. Here are the questions most people never ask, but should. What happens if I wait? What is the non-surgical option, and have I fully tried it? What are the long-term consequences, not just the short-term benefits? And perhaps the most important one, if this were your body, would you do it now, or would you try something else first? You might be surprised how different the conversation becomes when you ask that. Because medicine is not just about procedures, it's about decisions. And the quality of those decisions shapes everything that comes after. I've seen patients avoid unnecessary operations simply by asking one more question. And I've seen others wish they had asked after it was already done. You are not powerless in this process. You are the one living with the outcome. That gives you the right and the responsibility to understand every step. So here's what I want you to do. If you've ever been recommended a surgery, or if someone close to you has, share this with them. Not to scare them, but to give them the information they need to make a better decision. And I want you to tell me in the comments, have you ever been advised to get a procedure that didn't feel right to you? I read those stories, and they matter more than you think. Because the more people speak up, the more awareness grows. and the fewer unnecessary decisions get made in silence. Take your time, ask your questions, and remember, the best operation is not always the one that is performed. Sometimes it's the one you realized you didn't need.